Intermittent fasting has recently become a health trend. Many claim it can cause weight loss, improve metabolic health, and maybe even extend lifespan. Hi, this is Dr. Saurabh Welling, and welcome to Dr. Welling's Health Show. Let's see today what intermittent fasting is and does it have any risk factors. So every method can be effective, but figuring out which one works best depends on your individual circumstances. Intermittent fasting is an eating pattern that involves regular, short-term fasts or periods of minimal or no food consumption. Intermittent fasting is not a diet and it doesn't tell you what to eat. And it's not about cutting calories. It's a pattern of eating and not eating. It's changing when you eat and when you don't eat. It influences two main hormones in your body. It stimulates the growth hormone, which directly helps anti-aging and fat burning, and decreases insulin. Most people understand intermittent fasting as a weight loss intervention. So fasting for short periods of time helps people eat fewer calories, which may result in weight loss over a period of time. However, intermittent fasting may also help modify your risk factors for other health conditions like diabetes and heart problems, such as lowering cholesterol and blood sugar levels. So, intermittent fasting appears to help with metabolic health. It helps lower your blood sugar, blood pressure, decrease LDL, that's the bad cholesterol, and triglycerides. And also improves insulin sensitivity. So there are many ways of intermittent fasting. I would be telling only about the most common way of doing it. That's 16-8 method. The 16-8 method involves fasting every day for about 16 hours and restricting your daily eating window to approximately 8 hours. Within the eating window, you can fit in 2, 3 or more meals even. But it's advisable to eat 2 to 3 meals according to my experience. At every time you eat, you will get an insulin increase in your body, and insulin hormone is going to stop you from reducing weight or losing fat. Insulin helps store fats in your body, and regular insulin spikes can lead to even prediabetes. Doing this method of fasting can actually be as simple as not eating anything after dinner and skipping a breakfast. For example, if you finished your last meal at 8 pm and don't eat until the noon next day, you're technically fasting for 16 hours. For people who get hungry in the morning and like to eat breakfast, this method may be a little hard to get used to. However, many breakfast skippers instinctively eat this way. You can drink water, black coffee, or even other zero-calorie drinks during the fast, which can help reduce your feelings of hunger. It's ideal to go at least 4 hours after you wake up before your first meal. The real power of intermittent fasting happens at night while you are sleeping and in the morning. During your eating periods, eating normally does not mean eating any junk food. You are not likely to lose weight and get healthier if you pack your feeding times with high calorie junk food and supersized fried items. Fasting has several effects on your body. These effects include reducing levels of insulin, as I said, which makes it easier for the body to use the stored fat. The nervous system sends norepinephrine to your fat cells, making them break down your body fat into free fatty acids that can be burned for energy easily. And lowering blood sugar levels, blood pressure, and inflammation levels dramatically increases human growth hormone, which helps the body utilize body fat and grow muscles. The body activates the healing process. Some people should stay away from intermittent fasting, like children and teens under the age of 12. Women who are pregnant or breastfeeding, and people with diabetes or blood sugar problems, and those with a history of eating disorders. Many who are comfortably doing 16-8 type of intermittent fasting can graduate to 24 hours, which means you eat the food for the day at 12 pm and last food at 4 pm, which gives you the fastest and the easiest way to reduce that waistline. Now, this type of intermittent fasting needs you to eat the right type of fats so you don't feel hungry during your 20 hours of fasting and don't push you to break your fast. So, I'll be making another video on the right type of Indian foods to eat during intermittent fasting. Also, keep in mind the intermittent fasting may have different effects on different people. So, talk to your doctor if you start experiencing unusual anxiety, headaches, nausea, and other symptoms after you start intermittent fasting. Also, keep your patience as intermittent fasting is effective and has helped a lot of people lose fat the right way. Write your comments below or any question on intermittent fasting and I will answer them. That's all for today. Bye and take care.